Welcome to the Sunshine Training Center. For tips, how-tos, and videos on burn rehabilitation, subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. In this short video, we'll demonstrate the hook grasp training method, which is often applied in the management of post-burn intrinsic tightness. This demonstration was prepared by Vita Tu, occupational therapist and project manager at Sunshine Foundation. To learn more about what is post-burn intrinsic tightness and the management of this hand deformity, you can check out our online course Rehabilitation of the Burned Hand, Management of Common Hand Deformities. You can also read our blog post Overcoming Post-Burn Intrinsic Tightness, 5 Blind Spots to Avoid. The balance between flexor and extensor muscles of the finger should be maintained, whether at rest or in motion. Under normal circumstances, the extensor digitorum communis, EDC, intrinsic muscles, flexor digitorum superficialis, FDS, and flexor digitorum profundus, FDP, should be in a balanced state. Intrinsic tightness disrupts the coordinated balance between the muscles, causing severe contraction of the intrinsic muscles. This leads to flexion of metacarpophalangeal joints, excessive extension of proximal interphalangeal joints, and a tendency for the distal interphalangeal joints to develop swan neck posture in serious cases, mainly due to the loosening of the two lateral bands. This imbalance in the finger joints results in impaired grasping function. Muscles that maintain balance include FDS, FDP, and EDC. Therefore, muscle strengthening exercises need to focus on these muscle groups. In cases of severe intrinsic tightness, hook grasp training is crucial. Since proximal interphalangeal joints are pulled into excessive extension, strengthening the FDS and FDP can promote the performance of IP flexion, and hook grasp involves executing IP flexion while MP joints are in extension. Based on our experience, attaching small handles to the boxes of a sanding unit and placing weights inside the box to add appropriate resistance is effective. The patient grips the handles in a hook grasp position, and this can serve as a muscle strengthening activity for FDS and FDP. The patient holds the handles in a hook grasp position, slowly pulling the box towards the body. Pushing only requires using the palm. The hook grasp should be performed slowly and with correct posture. If the pull is too fast, it may be because the weight is insufficient, and there is insufficient resistance, thus compromising the muscle strengthening training effect for FDS and FDP. It is necessary to increase the weight appropriately to create the just right challenge. Hook grasp position can also be maintained in pronation, but attention should be paid to maintaining the correct hook grasp posture. When patients exhibit a cylindrical grasp, it is important to remind them to maintain MP joint extension and return to the hook grasp posture immediately. When pulling the box towards the body, the patient should be reminded to bend the elbow, as pulling with the elbow extended may involve compensatory movements using the upper limb and trunk muscles. Similarly, pulling should be done slowly, and pushing should be done with the palm. Using cylindrical objects such as an EZ board can also achieve hook grasp training. The Velcro's grip is used as resistance. The direction remains the same, allowing the cylindrical object to move from far to near, contracting the fingers FDS and FDP. The diameter of cylindrical objects can affect hand posture and, consequently, hand manipulation. When the diameter of the cylindrical object is small, the patient may tend to initiate DIP flexion, resulting in unexpected swan neck movements. Choosing the right-sized object is crucial. During execution, observe the quality of the movement and make timely adjustments to achieve the best training effect. Carrying a bucket produces a typical hook grasp movement. Placing sandbags in the bucket to increase weight can increase the level of difficulty of the training. Carrying one bucket in each hand can help maintain a more balanced body posture while walking. It is important to ensure that the patient's grip does not turn into a cylindrical grasp. When dealing with intrinsic tightness, it is necessary to remember these key points. First, to counteract intrinsic muscle tightness, FDS and FDP muscles need to be strengthened. Second, FDS and FDP muscle strengthening can be done through hook grasp activity training. In this video, we used examples such as pulling and pushing a sanding unit box, using an EZ board, and carrying buckets to demonstrate training methods. Third, during the training process, always pay attention to whether the patient is correctly performing hook grasp to achieve the best training effect. Thank you for watching. Remember to subscribe to our channel for more burn rehabilitation related tips and videos, and visit our website for news about our latest training programs.